Good morning, everybody. It's a pleasure to, we have a sponsored session. It's really a pleasure to introduce Dr. Manel Sabate from Cardiovascular Institute Hospital Clinic in Barcelona, who will give us a talk on the benefits of Allia IGS 7 during coronary intervention.
Thank you very much, Dr. Musa. Thank you very much for the invitation to this nice Congress and this fascinating country. My talk today will regard to describe the potential benefits of this new cath lab system, the Allia IGS 7, during percutaneous coronary interventions. I will focus on these four topics that I think, four features that I think are the most important ones from this new cath lab that provides really or are very helpful for the daily practice. First, I will discuss about the mobility of the system, then how to personalize the system, also the feature of the dose control, which is very important for our practice, and finally the multimodal integration of all the softwares we have available currently in our practice. Regarding the full mobility, this new system really provides any potential access to the patient and to the procedure. You can treat carotid, or you can access the carotid or the right femoral for structural heart disease. Of course, the radial access for any coronary interventions, axillary left subclavian. It's very helpful. This device, this system is on the floor, is not hanging on the roof, and can move in every single position, as you can see here in this video. You can put it perpendicular to the table, or you can put it in the axial configuration, the normal procedure during the radial access. But it really allows for any difficult access we can have in every patient. It's important to highlight a couple of things here. First is let me stop the video 1 second. This detector helps the movement of the device. There are several, a total of 12 detectors on the wall of the cath lab, and with this sensor, they detect the correct position, the accurate position of the table and of the patient in every single procedure. You can see here how the setting of a normal coronary access from the radial approach, but as mentioned, we can put it perpendicular, for instance, for a structural procedure, and then you can have access for the anesthetist, the echocardiographyist, to the head of the patient. This system also has an extra long table, 3.3 meters. This is useful for all the devices, the rotablator, the IVUS, the OCT, and also for the long sheath used in structural heart disease treatments. Of course, it supports heavy patients, but this is typical from any current cath labs. But as mentioned, it has extensive longitudinal travel from head to toe imaging. I think there is one feature which is important, that it detects the actual shape of the patient, has a detector and follows the shape of the patient, allowing for a close position of the intensifier to the patient to avoid excess of radiation. And then you don't have to take care of the face of the patient with the tube, because the machine do it for you. And you can also tailor the position of the gantry position to your own preferences. You see here how it moves. It follows the face of the patient, the shape of the patient, without touching the patient itself. I think this is an interesting feature. You can see here how the location of the arc in the cath lab. Here you can see the detectors on the roof, on the wall, You can just show in there. That allows on the detecting the position of the table for the C-arm. And another important issue is that you can see that the C-arm is a little bit deviated from the axis, and this allows to move the table from head to the toe and to allow to access the femoral, for instance, when you don't see you get stuck with the wire and you want to see what's happening there. Another view of the cath lab. Now we'd like to discuss a bit how to personalize the system. It's interesting that you can personalize the system on your own. You can have your own preferences for the settings, the radiation settings, for the position, and also you can differentiate between a structural and coronary procedure, or for instance a CTO procedure. Then you can select for less frames per minute to avoid radiation, etc. So you can have your own personalized system, and then you create upfront for every single patient and procedure. You can select then your preferences there. And also you can create your preferences on the screen for the OCT, the IVUS, the angiography, polygraph, etc. Another interesting feature is regarding the protection, radiation protection, the dose control. There are a few aspects to take into account that I think are of benefit for us as physicians. We can predefine the maximum dose we are going to give to the patient. And for instance, in this case, we have the 3 grays, and then we have at real time the percentage of radiation given in this particular patient. And also you have the dose rate meter, then allows you to, again, to set the maximum dose rate you are giving to the patient, and then you cannot exceed this, like a velocimeter in your car, you cannot exceed this dose rate. This, for instance, you are moving, and then while clicking the pedal, then you see that the maximum dose you are giving to the patient per minute in real time. And finally, and this is very important for our clinical practice, the multimodal integration. We can integrate any single software we know we have already available in our cath lab. We can perform the QCA analysis right on the screen, just with your finger, clicking and selecting, calibrating and selecting the frame you want to analyze, and you can have here the QCA analysis. And you can have here on the screen the QCA, the frame you select, and of course the preferences of the images you want. And also you can integrate the OCT. For instance, here you see the co-registration with the angiography, and how you perform the OCT together with the angio, and to assess the vessel anatomy, to measure the lesions you want to treat, with the stent or the DCB you're going to implant, and this is the result you have after this co-registration. Before and after, in this case, stent implantation. Also, and this is something that is very important, more and more important in the daily practice. You know the concept of the angio-based FFR, the QFR. Then also with this new, the Allia, you can integrate also the QFR in the cath lab, and you can perform the analysis online, and you can have the result immediately on your screen. This is because a joint venture between Medis, QFR, and General Electric. I think that it's getting more and more important nowadays to select the lesions to be treated and to do it online without using wires and giving adenosine, for instance, and this may be for the future an important asset. And finally, you have also the possibility to have the enhancement you have in different other companies. With this, in this case, is the stent or the vessel beads, the stent beads. and you can have this enhancement, which is important also for bifurcations. But you know that with other systems, you have the artifact of the two wires or the two balloons. But here we have a new software that can help you to have two balloons, two wires, and to perform bifurcations with a good enhancement of the angiography. So in conclusion, ladies and gentlemen, I would like to summarize the benefits, the potential benefits of the Allia IGS 7 during coronary intervention, saying that this allows all the possible needs from the clinical point of view regarding access site, visualization, treatment. It also allows for personalized settings for every patient, procedure, and/or operator. Optimize the administrative radiation. This is of importance for us because we are working every day for many years with radiation, so the radiation protection is of utmost importance in our practice. And finally, it facilitates multimodal integration of all available complementary software, imaging, physiology, QCA, QFR, whatever you think. Thank you very much for your attention.
Thank you very much, Mr. Sabate, for the nice presentation. This session was sponsored by the GE, so if anybody would like to ask any questions. If not, thank you very much. We appreciate your coming and presenting your lecture. Thank you very much.
Thank you very much.
At 12 o'clock, we have the year in interventional cardiology with 10 top news. This lecture will be given by Dr. Andreas Bombach. And also we have a very nice talk by Dr. Hania Tebe from UK after the 10 top news in the interventional cardiology. We have 10 minutes break and we'll come back at 12 o'clock. Thank you very much.